Welcome to all you guys out there in electronic land to another lovely Sanibel Symposium. My name is Kiel and I work for Transonic. We make flow meters. So last year we talked to you about our offerings in CP bypass and OR, specifically on our Auraflow system and our Optima using our flow probes. This year we want to talk to you specifically about ECMO specialists and perfusionists using our ELSA. So something that ELSA does really special, different than our traditional flow meters, is she measures recirculation. Not only that recirculation is happening, but the percent of recirculation is happening, and also something we like to call OxBV, oxygenator blood volume. And oxygenator blood volume tells us how big is that elephant in the room. We all know there's a clot in the oxygenator. It happens every time. But how big is it, and how do we measure it? So let's talk a little bit about ELSA. ELSA is a flow meter. She is going to come with two cords. Both of these sensors are the same size. One is going to go on our arterial and one is going to go on our venous. Because she comes together, I can do some special things, like measure two different flows. So not only can I do one flow, but I can do dual flows. I can also do measurements for recirculation. 10 cc's of normal saline, approximately. We can go down to 5 cc's and up to 20. It's 1 cc per kilo. That's really important in our PEDS patients. And we're going to give them a bolus of normal saline between the oxygenator and the pump. That normal saline bolus is going to be picked up by my first sensor. What is immediately returned is going to be picked up by my second sensor, and that's called recirculation. We're going to give you that as a numerical value in a percent of recirculation. Now, while I'm measuring recirculation, I can also measure OXBV with that same bolus. It's like buy one, get one free. So if I'm going to measure recirculation in my VV ECMOs, I'm also going to get oxygenator blood volume. Now you're asking yourself, Kiel, why are we measuring the volume of an oxygenator? It's the exact same thing. And you would be correct. The oxygenator has the exact volume, but the blood that's passing through the oxygenator at any one given time is definitely different. And anything that is not passing through the oxygenator is stagnant. I don't know about you, but I don't like stagnant blood. Stagnant blood stays forever. And what that does is it decreases the efficiency of our oxygenator. So if I have a 250 ml oxygenator and 50 cc's is stagnant, you get to call it whatever you'd like. I'm a flow meter, I only measure flow. If that 50 cc's is not moving, then I have just decreased the efficiency of my oxygenator. So what ELSA does is it allows me to measure that by finding a patient. I'm going to select a patient on my screen. Notice that I just found a patient. So what does that tell you? ELSA can move from bed to bed. So if I have a unit of 10 beds, I may only need 2 ELSAs. One that's pole mounted and goes around, and one that hides in a perfusionist's office just in case we need an extra one. So I'm going to identify that patient. I'm going to select that, and then I'm going to come over here and I'm going to say measure. It's going to ask me, what am I measuring? Am I measuring VVs or am I measuring VAs? I hope you're only getting recirculation in a VV. If we've got recirculation in a VA, we need to have a different kind of conversation. But I can measure just in my VAs, but I'm only going to measure oxygenator blood volume. For now, let's just say it's VV. I can measure recirculation by itself, or I can buy one, get one free. And I'm going to choose recirculation and oxygenator blood volume. Once I say okay, I can put in my priming volume. That is just the volume that's in the tube between my sensor. And for right now, I'm going to tell it that it's 100. My red light here is my sensors acclimating to the circuit. It's basically finding its own homeostasis. Once it turns green, I'm going to be able to measure and push that bolus. Once I push the bolus, I'm going to wait just under a minute, and it's going to return my values for me. Now, the other great thing that ELSA does is because I can move it from bed to bed, I can trend that data over time. So I'm going to have a bolus today, and I may have another one tomorrow. I may have another one in 3 days, in 1 week, for the longevity of my ECMO cycle. And I can watch how things have changed over time. Recirculation could change over time. Movement of the cannula. How hypovolemic is my patient really? What is their anticoagulation therapy? And I can monitor that. But something I like to look at that's really important, especially when we're talking about recirculation, and it's the bane of our existence in VA ECMO, and that's undiagnosed heart failure. So if I'm trending my recirculation over time and I see a large delta change, unexplained by anything else, the very first thing I'm going to think is, do I have undiagnosed heart failure? And I can immediately call for a chest x-ray just to chase down that cannula placement. And I can also call for an echo. And I want to know what my EF percent is. I want to know what my ejection fraction is. Because if we can catch that heart failure and then flip them to VAs, how many more patients can we save? So that's how ELSA can help us manage our ECMO circuits better. How efficient is my oxygenator, OxBV, right? So if I start at 100, but now I'm down to 90, maybe even 72. Do I need to call the perfusionist in at 2:30 in the morning? How big is that clot really? Well, I'm going to pull an OxBV and I'm going to see if it's larger than it was yesterday. Is it larger than it was on the previous shift? So what it gives you is back your power at the bedside to have quantitative values that tells us when, how, and how efficient our oxygenators are and our circuit is running at any one given time. So that's ELSA. Now, we also have Optima. Optima is also a flow meter. Nope, she doesn't do recirculation or OXBV, but what she does have are sensors that are particularly small. This one happens to be a 5, which might be really convenient when we're doing distal perfusion in peds. She also has ones that are smaller, maybe on our cardioplegia machines. We also have ones that are larger, which is really helpful in our CP bypass, 11s, especially on our cardiac machines. So again, my name is Kiel. I work for Transonic, and we make flow meters.